For this video, we'll take a look at the left side of the pony, and here you can see that we have removed that left limb. So we'll work on the detached left limb, but there was a couple things that I just wanted to point out here on the body. So after you remove your left limb, you'll have a few structures that you can see, and one of them, here you have the transverse acetabular ligament here going across the acetabular notch. And so I wanted to point out the remnant of that accessory ligament of the femoral head. So you can see that here and extending here, right there. And then that actually runs to the prepubic tendon. So the prepubic tendon actually is more by feel than by sight, but you can see it here where the probe is. And so the accessory ligament attaches in there, but you can feel it. It's a much thicker structure, and so when you're actually doing this dissection, you can feel it with your fingers and palpate that prepubic tendon there. The other thing I wanted to point out here was the iliopsoas muscle. So most of your iliopsoas muscle will remain on the body. It won't be with your detached limb. So that muscle belly is mainly here. So iliopsoas is here. And now we'll move to that detached left limb. Here we're taking a look at that left detached limb on the pony specimen. And we're on a lateral view here, so you're on the lateral side. You can see your biceps femoris here. And your tensor fascia lata is the muscle here. So this is a little bit disorienting because all of these muscles have been cut, so you have the distal parts but not where they're coming from. So this is tensor fascia lata muscle attached to the fascia lata. And the one thing you want to be careful with on this detached limb is that you don't completely lose your tensor fascia lata muscle. Oftentimes it will just get cut right off and cut through the fascia. So try to be careful of that and retain it if you can. So tensor fascia lata muscle, fascia lata is the fascia here. And if you reflect that distally, you'll take a look at the quadriceps muscle group. So here we have the quadriceps, and again it's that hot dog in a bun analogy. So you have the lateral side of the bun is vastus lateralis here. If I turn this a little bit, you'll hopefully be able to appreciate a little more of the hot dog in the bun perspective. So here would be bun vastus lateralis. Here would be bun vastus medialis on the medial side of the limb. And then in between is the hot dog part, the rectus femoris. So here's rectus femoris, and you can actually reflect rectus femoris distally and take a look at the bun. So here we have the bottom of the bun is that one that's hard to see, that vastus intermedius, which is in between those two sides, in between vastus lateralis and vastus medialis. Vastus intermedius in between on the bottom. And rectus femoris goes inside like that. So those are the quadriceps. Now we will take a look at the medial side. So I'm going to turn it over. Put that back before I do. And here, we'll take a look at the medial side, and I'll try and put things back where they go so we can start from scratch again. All right, so here cranially you have those quadriceps that we just talked about. And then as you move caudally, we want to look at these muscles here. So gracilis is the big flat one on the medial side. So here I'll elevate it a little bit. So this is gracilis, big and flat, and it's already been transected when we removed the limb, so you'll just reflect that distally. And then your sartorius will probably come with it. So they tend to be attached distally and they kind of merge together. So this is sartorius right here, this strap, and that kind of connects in with your gracilis here, as you can see. So you can reflect all of that distally. And then hopefully you'll be able to see your adductor muscle. So here's your adductor. Again, relatively small and ungulates as compared to the dog. So here you have adductor, and here next to it you have that really big semimembranosus muscle again. So semimembranosus, adductor muscle is here. And then as we move just slightly cranial to the adductor, we'll find this little pectineus muscle. So pretty small, but this is the pectineus right here. And then if you can imagine sartorius being back in place right there, you have that femoral triangle region. So in between pectineus and sartorius, you have the femoral triangle region right there. And you'll have your femoral artery, which is going to be the pink one here. And then femoral vein, which is the blue one. And so those are in that femoral triangle region. So femoral artery and femoral vein. Sometimes you will see those inguinal lymph nodes, but on this pony we didn't have much for deep inguinal lymph nodes, but you can look for them on your pony. All right, so now I'm going to move on. Since we don't have much for iliopsoas, I can point out the remnant of it that's left, but I did point it out on the body that was still attached. So you have iliopsoas here, but it's just a little nub right there. So that might be difficult to identify on the actual limb itself. So now we'll take a look at the stifle region. So I'll take it as a cranial view for you to look at. So here again is, I'll say it again, but you don't want to cut off your tensor fasciae lata muscle, and that can be very easy when you're doing this stifle dissection, and oftentimes it just gets cut off. So be really careful when you're making your cut around the patella here so that you try and keep tensor fasciae lata. All right, so here we have the stifle joint. So stifle region is here, the knee. And we're taking a look at these 3 patellar ligaments that you can see really nicely on this specimen. So they're named for regions as to where they're located. So you have a lateral patellar ligament on the lateral side. You have a medial patellar ligament on the medial side. And then you have a middle patellar ligament in between those two in the middle. So all 3 of those patellar ligaments are attached to the patella and insert on the tibial tuberosity on the tibia. And the cut you want to make to free that patella is all the way across the quadriceps muscle group and then on either side. So you're making a cut lateral to that lateral patellar ligament, don't cut through it, and then medial to the medial patellar ligament. Again, trying not to cut through that one either. And then take the whole thing, including your patella, and reflect it distally. So like I was saying on the right side, this is going to be full of fat and fascia, so you do have to be a little patient and remove some of that fat and fascia. And I'll try and point out the collateral ligaments of the stifle also here. So here on this side, we've got the lateral collateral ligament of the stifle joint. And then I'll turn it slightly to the medial side so we can see, if I can get the probe underneath, the medial collateral ligament of the stifle joint there. And then if we bend the limb as much as possible, you can hopefully get a good view of that stifle joint inside. And I'll try and point out those cruciate ligaments. If we can see in there, you can see these 2 ligaments crossing each other. So you have one here and you have one right here. So this one is actually going caudally and will insert caudally on the tibia. So that's the caudal cruciate ligament. And here, this one is coming forward, so coming cranially out at us, and it's inserting cranially on the tibia. So that's the cranial cruciate ligament there. And those are the cruciate ligaments inside the stifle joint.